So I will just ask Dr. Ingrid Wilson to join. Waiting for her, and then we can start and talk about alopecia. If you follow me, hello.
Hiya.
Perfect. So just to remind you, so today is the first day of the Alopecia Awareness Month. It is special for me just because one of my sisters has alopecia. She had it for about 10 years now. And opening to us, to me, to the rest of the family was difficult for her. And it was heartbreaking for me, really, to see that she was struggling just to talk about it. It took really a long time. And I know she's not the only one. So at Black Penis Beauty, I just want to have this conversation and make people comfortable, open to other people. And for those who don't know much about alopecia, well, tonight is the night to find out more. Because maybe you have people around you who have alopecia, but you don't know what it is, or you not just like being scared to ask. It's not cancer, because sometimes we think it's cancer when we're seeing somebody losing hair. So tonight we're going to talk about that and answer all your questions. So Ingrid, can you just introduce yourself briefly for those who don't know you, please?
Okay, my name is Dr. Ingrid Wilson. I've been a GP for 20 years, but I have an interest in helping people with hair loss. So I'm the founder of True Hair and Skin Clinic, which is a clinic that helps people with hair loss using a variety of approaches. So the main emphasis is on actually finding out what the cause of the hair loss is, and that's done by taking a very detailed history. So I'll ask lots of questions about the history of the hair loss, the general health, blood tests, nutrition, hair care practices. So it's a very detailed initial consultation. Since COVID, I've moved online to do the initial consultation. So what I do is I ask people to send photographs of their hair loss condition from the front, top, sides and back, as well as complete a short questionnaire, because sometimes people are taking lots of supplements or using lots of products that they don't always remember during the consultation. So that just helps us to save a bit of time. And then we do a consultation. I normally do a brief email summarising what I think the underlying cause is and what needs to be done next. I offer a DNA test called the Trico test, which also helps. It doesn't diagnose, but it helps to personalise what kind of treatment you need. So it's for certain types of hair loss, mainly balding, alopecia areata, and telogen effluvium, which is hair shedding, and that basically helps to give advice about what supplements or nutrients you might be deficient in, or what kind of medication is more likely to work for certain hair loss conditions.
Can you just explain what it is? Because it might sound like a scary word for some. What is it?
I think when people hear the word alopecia, they think of the charity Alopecia UK, which has got lots of people with a particular hair loss condition called alopecia areata. And these people, they experience total hair loss. But essentially what alopecia means is it's just a general term for hair loss, regardless of cause. And there are many, many different causes of alopecia.
So it's just like a generic word for hair loss, but
yes,
underneath you have different types, right?
Yes, that's correct. Yes.
Perfect. So does it affect only men, women? Does it affect children?
Very good question. Essentially, alopecia can affect anybody and everybody: men, women, children, adults, older people. But you might get certain types of hair loss that happen in certain groups of people. So for example, young boys, particularly of Afro-Caribbean descent, might be more prone to a condition called tinea capitis, which is basically an infection that can lead to hair loss. So children tend to get that, not adults, unless they've got a problem with their immune system. And then we're all familiar with balding. So that's the type of hair loss that we all get to a certain extent as we get older, but some people will get it more than others. And again, the type of hair loss you get depends on your gender. So men will lose their hair in a certain pattern. They'll lose their hair at the temples and the top, whereas women will lose their hair mainly at the top, but retain the hairline. And as I say, there are a few other conditions that affect certain age groups more often than others, and that also helps to find out what the diagnosis is. And I suppose the important thing to know about this is that with certain types of hair loss conditions, some can be temporary and some can be permanent. So the ones that are more likely to be permanent are the ones that need to be referred on to a dermatologist, who is a doctor who specialises in skin, hair and nails, because they have access to a wider range of medications that they can prescribe, which are usually more potent than what a GP can prescribe. And they can also perform biopsies, which are taking small samples of the scalp to look at under the microscope. So as I say, different ages, different gender, you get slightly different conditions. But mostly we start off by the story, so the history. Are there any associated symptoms? So for some conditions, they might have a medical condition that might be contributing to the hair loss. So for example, women who suffer with polycystic ovarian syndrome, which can have other symptoms like acne, excess hair on the face, difficulty losing weight, they can experience hair loss much earlier than you would expect. So say somebody in their 20s or 30s would have a hair loss pattern of somebody in their 50s and 60s. And sometimes you might start the other way around. So the pattern of hair loss might give you a clue that something else may be going on. But it's the history, associated symptoms and signs. So there's a hair loss condition called frontal fibrosing alopecia, which is basically a scarring or a potentially permanent form of hair loss, where people have kind of a kind of smooth band of hair loss that looks like a high hairline. And sometimes that presents with associated symptoms and signs. So things like they might have little spots on the face, which we call facial papules. They may lose their eyebrows. They may get a problem with wrinkling in front of the ears. And as I say, that's the kind of detective work that you end up doing to try and work out what the issue is. So most of the time you get a general idea of what's going on, but occasionally there'll be some hair loss conditions where you think, oh, I'm not quite sure about that one, or it looks like it could be potentially permanent or scarring. And usually the area of hair loss looks quite shiny, and that shows that the hair follicles, which are the pits from which the hair grows, it looks like there's not going to be hair growing from that area again. And when you see that, that needs to go to a dermatologist for further review, which is usually a biopsy, taking a sample, or perhaps looking at it with a special kind of lens called a dermatoscope, which uses polarized light to look at the scalp. Yes, I suppose I've mentioned balding a bit, and I would tend to see people who were getting it early. So I see young men, usually around age 20, who are experiencing hair loss, and obviously they look around in their family and they see that there's an uncle or a parent that's lost their hair very early. And these days, people are much more, they're much more I notice that young men seem to be much more conscious about keeping their hair than previous generations may have been, because 20 years ago men would have shaved their hair off like my other half did, because that was kind of the fashion at the time. But now you've got the man bun and all those things that require hair. So I will tend to see younger men. I might see women around the menopause. They might have other things going on in their lives, and they're experiencing excess hair loss and wondering what they can do about it.